voice. Dear viewers, good evening. I'm delighted to welcome the Senior Consultant and Cardiologist, Dr. Vivek Gupta, on this World Heart Day. And I'm delighted to interview him today, this evening. How are you, Dr. Vivek Gupta?
Good, good. As good as you.
So today, as I interview you, I'm reminded of these famous lines of William Wordsworth, which says, "The heart flutters as I behold a rainbow in the sky. So was it when my life began. So is it now when I'm a woman." So tell me, doctor, what is that magic trick which keeps the heart young and active throughout?
Actually, the very good question, and I'm thanking you, Ruchi ji, to have me here to talk about heart. And World Heart Day is celebrated on 29th of September, which has been now 2 days old, but still it is good to be talking about heart. The whole week is the World Heart Day. So let me introduce. World Heart Day has been actually named to be on September 29. It is by World Heart Federation, which is the body, international body, and which is the theme is to prevent heart diseases. The World Heart Federation has put 29 September as the World Heart Day, and this is being celebrated just because, of course, every day should be a heart day because the heart is most important organ of the body, and this keeps you alive. So 29 September is a day where you can think about your heart, you can love your heart, you can, as you said, that how to keep the heart healthy and young. But of course, heart also suffers diseases. And of course, this is the one of the most important and the number one killer for the heart for overall is heart disease. Heart attack and angina is number one killer. And before you ask another question, let me just give you the statistics. The statistics coming from United States or for the whole of the world, 1.86 million people die every year by heart disease. And which is
That's a huge number.
Huge number. And especially the women. Women also is every fifth woman is dying of heart disease. But this is also another statistics. The women were earlier thought that women are safe from the heart disease. Not true. Especially now working women are there, and they're also competitive anxiety, stress, all those things. So to keep the heart healthy, we have to be as cheerful as you and as much as possible being happy and believing in God. That is my philosophy. Then I'll answer your other questions later on.
Wonderful. That was insightful. So tell me, doctor, when you say stress, so as heart and mind are interrelated, so that means that stress is a major cause for a cardiac arrest?
Yes, that is true. And to explain you further, I'll take this model in my hand. So how the heart functions. Heart is actually situated just in the middle of the body. People think it is on the left side. It's not true. Of course, one part of the heart is like this, so that I'll just put up so that the apex is on the left side. Otherwise, it's on the center of the body. So heart is made of muscular body. It's a muscular organ which has got 4 chambers, two upper chamber and 2 lower chamber. And out of this, the left lower chamber, which is known as left ventricle, is most important because this is circulating the blood out of the body. And what is the function of the heart? Heart is constantly contracting and giving blood to the whole of the body. The only purpose of the heart is to give and supply oxygen to the blood. That is all. And as soon as the child is there in the fetus, at the fetal life, as soon as the child is there in the womb, and the heart starts contracting and is continue to contract and work tirelessly till the patient dies. So this is the only organ which is constantly working. Why? Because you have to keep the other organs safe. The most important organ, I would say, this is, you can see the left ventricle. I will put it like this. And this is the aorta which is arising. And this aorta gives rise to various branches. And one of the most important branch which goes to supply is the brain. The seat of life is brain, not heart. If you can have another artificial heart, you can take away this heart and put another chamber which is contracting, the life will be there. But the seat of the life is brain. But to keep the brain alive, it has to keep on pumping oxygen in the blood throughout the body. But for its own survival, for its contractility, it also requires oxygen. And this is done through three coronary arteries, which is supplying the blood to the heart muscle. Because finally the heart muscle has to contract. So these three coronary arteries are supplying blood, which are the branches of aorta. So what heart does, as soon as the aorta arises, it first of all supplies itself, because it has to keep working. And then the blood goes to the brain, to the kidneys, to the hand, to the lower limb, to the intestine, and the rest of the body. So every beat means a supply to the whole of, for example, if the heart is contracting at the rate of 80 per minute, that means in 1 minute it is contracting 80 times. And in one contraction, it is supplying the blood, and at the same time, the blood is coming back through the veins and goes back into the right ventricle, and right ventricle to the left. There's a circle through the lungs where it is oxygenated, and then blood comes back to the left ventricle and again goes up. So it is so fast. I mean, within one contraction, so much of system. I mean, this is much better computer which the God has made than any computer where we are talking about this thing. So this is the most beautiful computation or by God, that how the heart keeps functioning all through the life. So you asked me the question, stress. So these coronary arteries are so thin. They are just 3 millimeter in diameter. 3 millimeter. I will show you an example. This is my fist. And there are, you see the radial artery, pulse. When you see the pulse, it is actually an artery. This side is an ulnar artery and this side is a radial artery. So I will give you an example. I close this fist completely and you see it is white. As soon as I release it, it becomes red. I will do this again. I have closed it, blocked the arteries completely. It is white. As soon as I release it, it is red. So now the blood has gone. So normally the hand is having a mild reddish purple, but if you close it and block it, it is white. That means there is no supply. Now it is red. I think you have noticed the changes. So similarly, if these arteries of the heart get blocked by a clot, then the patient will suffer a heart attack. Now your question, stress. Stress is one of the most common factor, or rather I would say there are normally 5 risk factors for heart diseases. We are talking of angina and heart attack, where these arteries, which are thin arteries, get a cholesterol deposition, or else there's a clot formation, which can lead to sudden cardiac arrest, as you said. So normally the 5 important risk factors are diabetes, which is high blood sugar, high blood pressure, which is hypertension, smoking, which is cigarette smoking or tobacco chewing, hereditary, very important, genetics plays an important role. Any patient who has got a family history of cardiac arrest, bypass surgery or angioplasty, that means father, mother, brother, sister, grandfather, chacha, chow, he has higher chances as compared to normal population. So these are, and high cholesterol levels. These are the 5 regular, routine, normal risk factors which can lead to cholesterol deposition in the arteries. But to add upon that is now the stress. If the patient is having mental stress continuously, it can affect by 2 ways. First of all, it can lead to spasm of the artery. Normally the artery is like this, So because of stress or anger, it can lead to small spasm. That means the bore of the artery will go down, like if it is normal like this, it will go down like this. And if there's a cholesterol deposition, at the same time, about 20-30%, it will behave like 80 to 90%. On the other hand, stress can also lead to accelerated deposition of cholesterol inside the coronary arteries. So to remain happy is the most important thing. Be happy, believe in God. And once you believe in God, God will take the best decision for you. And therefore the stress will go away to some extent.
Brilliant. No wonder, doctor, that you're a brilliant professor as well. The way you explained, exemplary. Very good. Wonderful. So, doctor, coming to this, nowadays, most of us, they're running to just be fit and to lead absolutely a fit life. So, but we see all around that the fittest people are, getting prey to these heart attacks and cardiac arrest. So what is the reason? And if you can give more insight towards it.
You see, the fitness of the body does not directly correlate with the fitness of the heart. This is very important. The fitness of the body, what we see fit, any person who's lean and thin, who has got big muscles, biceps, exercising, and like too many Bollywood stars who would like to show that they are fit. But the fitness of the heart is not at all or no direct correlation with the fitness of the heart. Body fitness does not mean heart fitness. So to have a fit heart, you have to do so many other things other than regular exercise. In fact, it is other way around. Those who are trying to be fit by increasing exercises, too much exercise capacity, taking unnecessary proteins or anabolic steroids, that is actually dangerous to the heart, and that can actually accelerate the blockages because of cholesterol or plaque rupture. I will explain to you what is plaque rupture and what is cholesterol, because it's very important.
Yes.
So if you do too much exercise, that can lead to plaque rupture. And what is plaque rupture? I told you this artery is only 3 millimeter in diameter. Artery means artery which is supplying, this is the artery which is supplying the, you can see the pulse. You cannot feel this artery which is supplying the heart because it is behind the bones. If this was a little over, you can also feel the heart artery, but this is protected by bone because heart is so delicate. God has made it protection. Here you are feeling the pulse. This pulse means this is an artery which is contracting. We can see the pulse. Why we always see the pulse? A lot of people say, Namas dekh liya, aapko theek hai, because he is through the pulse, he's seeing the contraction of the heart. When the heart contracts, the pulse comes. Heart contracts, the pulse comes. Similarly, we can also feel the artery of the carotid artery. We can see the pulse here. We can feel the pulse here. The doctor who knows wherever the pulse, you can see the pulse on the dorsalis pedis on the foot. You can see the pulse on the ankle. So there are a lot of places, but this is most commonly seen. So what I was telling is the cholesterol deposition leads to angina, while plaque rupture with clot formation will lead to heart attack. Difference between angina and heart attack is very important. Angina is a pain of the or cry of the heart. If the patient is walking 1 kilometer, patient says, I feel chest heavy or pain. When I take rest, I become normal. This is known as classical angina. Why? Because it's an imbalance between the demand and the supply. Supply is limited because there is a cholesterol deposition. Now it is limited. While the demand goes up when the patient walks. When the patient walks, his heart contraction, which is normally 70, 80, becomes 100, 110 because he is exercising almost. And that time, the demand is more, supply is limited. There will be a reduced supply to the myocardium, which is the muscle, and this will cry in the form of pain. And that is known as angina. This is because of the fixed blockade, which is a cholesterol deposition over a period of years, starting at the age of 20, and finally it becomes 70, 80%, and the patient will have a fixed blockade. Whenever he exercises, go uphill, or take bath, or take food, or walk for 1 kilometer, he says, when I walk for 500 meters to 200 meters, now the patient, I will start having just feeling of breathlessness with little ghabrat, suffocation. I take rest, I sit down, I become normal. Because when he sits down, the heart rate, which was 110, has come down to again 60 to 70. Now the demand is almost normalized and he has no pain. This is angina. What is heart attack? Any blockage which is 60%, 50%, or 70%, that blockage does not lead to complete occlusion of the artery because the artery is still flowing, although it has a fixed blockade. But the plaque means the cholesterol blockage. If it ruptures, that means there is a small covering on the plaque. I'm talking of internal artery inside the coronary artery, like a pipe. The small covering, endothelium, that ruptures, that will invite platelet and a fresh clot formation. What is clot? Is a thrombus. When you do a cut, for example, there's a cut, after you have a bleeding and you press it and it stops bleeding. Why it stops bleeding? Because now it's a clot formation. God has made a system where when the arteries are flowing inside the body, they don't clot. Otherwise, there will be no supply and the patient will not survive. While as soon as the blood comes in contact with the oxygen in the air, you have cut, blood comes out, there's oxygen, the blood comes in contact with the air, and it immediately precipitates the clot formation. But if this clot formation happens inside the coronary artery because of plaque rupture, there will be thrombus formation. A block which was actually 20% will become 100%. Now the artery is completely occluded. As I'm occluding this artery, I'm completely occluding the artery. Now it's white. Similarly, when the heart becomes white like this, you cannot see. A patient will have severe pain, severe chest pain. He can't tolerate. Okay, I'm dying. And this pain is so severe The patient will have suffocation, sweating, ghabrat, hypotension, and sometimes patient will have cardiac arrest and die. That is why heart attack patients, only 50% of the heart attack patient, they will reach hospital. 50% will die either at home, or they will die on the way, or they will die inside. That's why heart attack is much more dangerous than angina. What happened? I think that recently there was a television star, without naming him. He died during sleep. And he was doing too much of exercise, gym, all those things. I don't know whether he was taking anabolic steroids or not. So sometimes while he's relaxing after the gym, the arteries, the plaque will rupture because there's too much of flow inside, and the plaque ruptures, leading to clot formation, thrombus formation, and this patient will have a heart attack within few hours, not immediately. It takes some time, because it takes time. There's first of all platelet, then there's thrombus formation, and then you feel unwell and you feel, okay, I'm not feeling well, let me go to sleep. And he goes to sleep permanently, because then he has a large heart attack, and when he's sleeping, he might be having mild pain. Sometimes the patient gets up when they have this severe pain, but sometimes there's a mild pain and the patient will fall asleep and cardiac arrest during sleep, and patient will not get up next morning. I want to tell you one more thing, very important. The severity of pain does not correlate with the severity of disease. Many patients will have a very mild pain and they have a sudden death. Many patients will have a silent heart attack and there's no pain, just a small swelling and they collapse. So why this happens? Because especially in diabetes population, the nerves which is coming from the heart to the brain, you see why you feel pain. When I cut my fingers like this, I will feel pain because there's a nerve which goes from the hand, it goes to the brain, and I feel the pain. So what is pain? Pain is a very, very important defense mechanism. If you don't have pain, you will not take care of your heart. Somebody cuts your finger and you will not have pain and you will keep sleeping. Okay, next morning, where is my finger gone? It's the pain which prevents you to take action against any problem in the body. Similarly, angina is a cry of the heart. It's good to have pain rather than have a silent. But 30% heart attack patient, 30% angina will not have severe pain. And sometimes they have mild pain. This is because there's a neurological disturbances which take the pain from the heart to the brain. And the nerves are quite weak, especially in diabetes. So this is the difference I told you. The plaque rupture leads to heart attack because of clot formation. Angina, fixed cholesterol deposit, does not lead to a severe heart attack. It can only lead to pain, but it will not be life-threatening.
Excellent. So that gives insight about, one has to keep it balanced, and Almighty has created such a wonderful mechanism. Thank you for wonderful explanation. So Dr. Almighty has also created, like a mechanism of emotions. So the heart flutters when somebody is excited, somebody is sad. So how to keep it balanced, constant, to lead a healthy but a fun life?
Okay, so it can be a romantic question. When the heart flutters, you see a young woman or young girl who is very beautiful and your heart skips. It happens actually. With the heart skips and okay, that's another thing. That's a dil lagi alag baat hai. But you see, to keep yourself fit, it is good to exercise, very important. But exercise in a limited way, not more than half an hour a day. I think not more, maximum 1 hour if you have time. This is one thing. And to keep happy, you have to of course, do yoga, meditation, all those things. But before that, I will tell you how to prevent heart disease. That's most important. If somebody in your family is having diabetes, you can control the diabetes. But a lot of times, patient does not start medicines. This is very important, practical problem. Okay, आज दवाई शुरू करेंगे, जिंदगी भर खानी पड़ेगी. Let me check on my diet. I will finish off my sugars. I will not eat mithai. I will reduce my diet, and let me see after 2 months how much is the blood sugar. That is not the right way. If the doctors advised you to start medicine, start the medicine. That is a better way of controlling blood sugar. Similarly, for high blood pressure. My blood pressure today is 150 by 100. Doctor, I don't want to start medicine. Let me cut down my salt. I will do exercise. I have come to know that exercises also reduce the blood pressure over a long period of time. I say no. If I start medicine today, it will be lifelong. I say no, that's not true. Even if you have to take a medicine lifelong, it is still preventive. So the most important hesitation in most of the patient is not to have medicine for the life. I'll tell you, you eat food for the life, you drink water for the life, you enjoy for the life. Why can't have 2 pills for the life? That's very important. You have to have controlled blood sugar, controlled high blood pressure, and of course, avoid smoking, passive or active, both. Tobacco chewing is very important, especially in rural areas. A lot of pan masala is available and they are so addictive and they can't stop it. I have seen even non-tobacco pan masala is dangerous because there's something hidden that which makes the person addictive in the non-tobacco pan masala. This is very bad. And similarly, now I told you 4 things to remain happy. One is control your sugars, control your blood pressure. But at the same time, there are patients who do not know that blood pressure is not normal. I've seen so many patients in Apollo Hospital who comes for the whole body check and they have, oh, I found diabetes. I was never diabetic 2 years back. My HbA1c is now 8. I said, yes, this is what you want to do and check it. Similarly, high blood pressure never checked for 3 years. I have seen a lot of people, they don't check the blood pressure. And now the blood pressure comes out to 170 by 100. So that means for 3 years or 2 years or 1 year, we don't know, his blood pressure remained unchecked. And therefore, this is important to do a regular whole body checkup at least once a year. Or if not, at least 1.5 years every year. If you found that yourself that you have high blood pressure, diabetes, cholesterol, high cholesterols, control the cholesterol. Similarly, for cholesterol, it's very important. Guidelines are changing for cholesterols. Earlier, there are 4 actually cholesterol, total cholesterol, triglycerides. Then there is a high HDL, which is a good cholesterol. Then there's a LDL, which is bad cholesterol. If you see the most of the pathological reports where they were right LDL less than 130, less than 130 is normal. Actually, it's not true. The guidelines is changing, and you have to consult your cardiologist to tell whether your cholesterols are high or not. Similarly, if there's a mild to moderate increase in cholesterol, still the patient hesitates in starting cholesterol medicine. I say no. Well, see, he said, let me try for 6 months. My diet, I'm taking too much of cholesterol, like I'm taking ghee and butter. Let me cut down on that. It's not practically possible. What I want to say, I'm not advocating that you should start medicine, but if it is really required, start medicine rather than waiting for your lifestyle changes. Of course, lifestyle changes do go hand in hand. But don't observe yourself that even if you have, I tell you, okay, blood pressure medicine you start today. After 3 years, if your blood pressure is normalized, we can take a rest for 1 month and we stop the medicine. We can check if your blood pressure is controlled even without medicines, then you can go ahead. But start the medicines. Start the medicine if that is actually required. Most important part, which I would like to tell you regarding investigation, which is very important. You see how to diagnose heart attack and angina or heart disease. For example, a patient comes to me. He says, I want to know my heart condition. I said, we have to do ECG. We have to do treadmill test. We have to do echocardiography. These are 3 common, actually, tests which are advised by any cardiologist or physician to know about the health of the heart. ECG, I would like to tell you one by one whether they are completely ruled out or not. ECG can remain normal even with 95% blockage. But that means a normal ECG does not guarantee a normal heart, but an abnormal ECG just tell you that, of course, you have a blockages and you had a heart attack earlier, or maybe it's going on. So to get a normal ECG is, of course, quite reassuring. Many times it's reassuring. मेरा ECG normal है, I don't have previous heart attack, and मेरे पास जो और बीमारी थी वो भी नहीं हुआ, और अभी इस समय जो chest pain हो रहा है, because many times it could be muscular chest pain. Many times it is not all chest pain will be heart pain. I will tell you the difference very soon. But if you have normal ECG with the chest pain ongoing chest pain, it almost rules out the heart disease. But there are limitations of ECG. Coming to echocardiography. What is echocardiography? Everybody knows echo. Echocardia. Echocardiography is just a simple plain ultrasound of the heart. What does it tell? It tells about the heart contractions. I told you heart contraction, whether all the valves are contracting well or not. It tells about the valves. There are 4 valves inside the heart, whether the valves are okay or there is stenosed. And of course, it will tell about, but it does not tell any blockages. It will tell a previous heart attack. It will not tell the future heart attack. You see, the blockages can be confirmed only by 2 tests. I'll tell you. Now, coming on to treadmill test. Must have exercise and then ECG. This is treadmill test. So treadmill test will tell you any blockage, if there is a blockages inside the coronary arteries, if they are more than 70%. A 50% blockage in all the 3 arteries will be completely missed by treadmill test. Completely missed. That means somebody has a normal echo, normal ECG, and normal treadmill test. Then he asks me, my heart is completely healthy? Yes, I say almost healthy, but at least the blockages are not severe. If you have at all, then he wants to know, how do I know that I have minor blockages or not? It's very important. But for example, a young lady like you, or you can ask yourself whether I have minor blockages. What we have to do, another test which has come recently, is CT scan of the heart. You have heard of CT scan of the brain, CT scan of the hand, abdomen, but CT scan of the heart was not well known. Now this is new machine which has come, which will tell a 40%, 20%, 30% blockage, TMT normal, echo normal, ECG normal, but you have a 40% blockage. What to do? Start medicine so that it does not progress. Start medicine so that it does not lead to heart attack. Start medicine so that it does not lead to plaque rupture or heart attack. Similarly, recently, a person of a TV star who died, if he had a CT scan done earlier, before gymming and all those things, maybe we would have, maybe, I'm not sure because we don't know anything now, maybe we would have discovered a 40% blockage. We could have started some medicine which would have prevented a plaque rupture leading to heart attack. So these are the limitations, this is important. And finally, the coronary angiography. Angiography is the gold standard to diagnose a heart attack or angina or any minor blockage. It is more sensitive than CT scan. But angiography has a limited or very classical indications. You can't do angiography to everybody. If somebody comes with a healthy person, okay, I want to know, I would like to do CT scan, not coronary angiography. But at the same time, if somebody has an abnormal ECG, abnormal echo, abnormal TMT, go for angiography directly. If somebody has severe chest pain, which is classical angina, go for angiography. If somebody has poor heart functions, go for angiography. If somebody has had earlier heart attack, is on medicine. A lot of patients are living on medicine despite heart attack, and they never had angiography. This is actually a bad thing. It's pity in our country it's happening. But if it comes to me, I say, okay, you have never done angiography. You're living for last 10 years because we don't know what is the status of coronary arteries in your heart. We don't know. You had one heart attack, but we don't know the two arteries, whether they are okay or not. At that time, you have to do a coronary angiography. This is the only test which is life-saving test. I call it a life-saving test because if you pick up some more blockages, you will do, and you will, what you will do? You will do a stenting, coronary stent, which is a 15 minutes procedure. It is non-surgical, no opening of the chest. If you have many blockages, then unfortunately you have to do bypass surgery. But again, it's a second life to the heart. So don't avoid angiography if at all it is prescribed by cardiologist or physician.
So my dear viewers, we all will be reduced by heart attacks by getting such wonderful tips from our very, very dynamic Dr. Vivek Gupta. Thank you so much, Dr. Vivek Gupta. It was really insightful. And I'm sure, you know, these tips are going to be really preventive measures. Thank you.
At the same time, I should thank Ruchi ji for taking your time so that we could at least educate somebody if this goes on air or it goes somewhere. A lot education is required. Our country is 137 crore population, huge number. And I'm sure that a lot of people are still not aware about their heart conditions. And we can reduce the morbidity and mortality, reduce the cardiovascular burden, reduce the problems with this. Last thing which I want to tell you that COVID has actually precipitated heart attacks. A lot of patients of COVID, of course, the most important cause of death in COVID is the lung pneumonia. But many patients have also died because of the plaque rupture or because of clotting, because this COVID virus, coronavirus disease, accelerates the thrombosis inside the blood inside. You must have heard of D-dimer test. D-dimer test tells you the coagulability of the blood inside the body. And this virus somehow increases the coagulability, and not only in the heart, it can also lead to stroke. It can lead to the legs, and many patients, despite having a normal lung, no major pneumonia, have died because of heart attacks. So we have to be very, very careful. And on World Heart Day and on the second day of this is the whole World Heart Week, I would say. I'm thankful to Ruchi ji to to at least try to convince or try to educate at least something to the normal population. And heart is health. I would not say health is wealth. Now I'll say heart is wealth, number one. And love your heart. Then only you can save your heart. God has given 2 eyes, 2 brain, 2 parts of the brain, 2 kidneys, 2 hands, even 2 parts of the liver, 2 lower limb, 2 feet, but only 1 heart, unfortunately. If I was God, I would have made 2 hearts. If one collapses, okay. The other one is contracting. So for example, 2 engines in the aircraft. If one engine goes away, the second will at least take you down. But here it's only 1 heart, unfortunately.
No wonder, doctor, your patients rave about you and say that the way you educate them, I think it saved the generations of their family, you know, like from heart attacks. So please keep it up. Wonderful. So we require doctors like Vivek Gupta more. And thank you, doctor, for enriching and educating us. Thank you. Thank you, viewers. Good night.